Hello, guys. Welcome to a brand new episode of the Anti-Pharmacist Podcast. It's been a long time, right? Did you guys miss me? Well, I know you did, and I missed you too. Shout out to those who reached out and were asking, What's up? Anti-Pharmacist Podcast has not been on for a while. Well, guys, things happen in this life, and especially in Nigeria, we just have to go with the flow. You see, there were a lot of technical abnormalities, but thank God we have overcome them right now. I came across a post a while back. To paraphrase it, what it was just saying is that when faced with challenges, we shouldn't quit. Instead, we can pause, re-strategize, and face it head on, which was what I did for the podcast. And I'm happy to be back. You have no idea. Thank you so much for the support so far, and I know that you keep supporting your girl. So yes, Anti-Pharmacist Podcast is back and better. Alright? Yes, so watch out for very interesting content. As usual, we don't give you things that are irrelevant here. All our topics are relevant. They will ever be relevant to your health. You understand? Yes. So today's episode is about the World Health Day, which was celebrated yesterday. What is World Health Day about? Well, it is just like the birthday of the WHO. We know that WHO is World Health Organization. So World Health Day is commemorated every April 7th every year on the founding day of the World Health Organization. And the day is observed in order to raise awareness about global health issues, highlight the importance of well-being. And this year's theme is My Health, My Right. So I thought, what other topic should we discuss today, if not that? Really, my health, my right. So the topic of today's discussion is just around what this theme means to you and me. My health, my right. When you think about it, yes, what does it say? It's just saying that everybody has right to good health care. But then we have the right to good health care. How many of us are actually exercising this right? Yeah. You don't have to have so much money to access health. It's part of the fundamental human rights. It's part of the Millennium Development Goals. The WHO is in charge of the World Health, and it's telling you that you have right to good health care. So do you actually exercise this right? Do you access it? And how can you do that? So that is what we'll be discussing today. So, like I usually say, let's get right into it. I'll take an excerpt from WHO's official website. Alright? Around the world, the right to health of millions is increasingly coming under threat. Diseases and disasters loom large as causes of death and disability. Conflicts are devastating lives, causing death, pain, hunger, and psychological distress. You don't have to be told. You know what's happening in Gaza. You know what's happening in Ukraine. There are a lot of people there. Even hospitals are being attacked. You see? So the right of those people to health has been infringed. Then there is the burning of fossil fuel, which is simultaneously driving the climate crisis and taking away our right to breathe clean air. As the people in Port Harcourt, where soot is everywhere, with indoor and outdoor air pollution claiming a life every 5 seconds. That's according to WHO. Now, the WHO Council on the Economics of Health for All has found that at least 140 countries recognize health as a human right in their constitution. That's a large number of countries, you agree with me. Yet, countries are not passing and putting into practice laws to ensure their populations are entitled to access health services. This underpins the fact that at least 4.5 billion people, that is more than half of the world's population, were not fully covered by essential health services in 2021. Now, to address these types of challenges, the theme for this year's World Health Day is My Health, My Right. And this year's theme was chosen to champion the right of everyone, everywhere to access quality health services, education and information, as well as safe drinking water, clean air, good nutrition, quality housing, decent working and environmental conditions, and freedom from discrimination. This is like the WHO's vision for World Health. And it has been said that 140 countries have actually keyed into this. But the problem now is implementation. One of your access to good health is right to the correct information, which is what I'm bringing to you. So I'm helping you to access your rights. Now, you will agree with me that it is not enough to have a right or to know that you actually have rights. You must go further to exercise this right. So you must know ways to actually exercise the right. One of the ways of exercising your right to health and accurate information is to source your information from the right sources, like this podcast, where I bring to you the right information about your medication and your health, like getting your medication from the right source, not from hawkers on the street or from people who know nothing about medications but just the business aspect of it. It is going to the hospital when you are not feeling well, when you are being referred from the pharmacy, like, okay, you went to the pharmacy, you are not feeling well, and your pharmacist tells you that, oh, you have to run some tests. You go to the lab, you run the test, or they refer you to a doctor. It's not for you to go back home. You're not exercising this right. Even though you have right to healthcare, if you don't do these little things, that right is as good as non-existent. And we should know that with every right comes responsibility. So you can't just claim to have right to health without taking responsibility for your health. And that is all I've been saying on this podcast since its inception. How you should take care of your health through your diet, through exercise, through adequate rest, through hydration, knowing how to deal with each season that we're in right now, and a host of others. This information are available to you. All you have to do is listen to them, follow them, and share them with your loved ones. And I'm sure that with time, you see that you're actually exercising your right to health. Unless I forget, know that you have right to health insurance too. And there's the National Health Insurance Authority. You can access health insurance by, finding out how you can enroll yourself and your family members. And then your cost of medications will be subsidized, at least significantly. Most people will have to pay 10% of the cost of medication, at least for those medications that are covered. It will take a lot of financial burden from you, especially in this era of very high cost of medications. So these are things that you can do. Get the right information from the right source. Access health at the right places. Don't visit quacks all in the name of you're saving money or something. It can come back and affect you. And while you are taking care of your own health, please also try and safeguard the health of people in your environment, because at the end of the day, if it affects them, it might just come back to you. So these are the ways by which you can exercise your right to health. Of course, your country has provided everything you need to access care, but then you are not making use of them. So your health, your right, yes, it is, but are you utilizing that right? Also, you go to the hospital, for example, and you don't have much. Do you know that you have right to actually be indebted to the hospital for a while? You have right to emergency care, for example. Now, the law has been passed that every bullet wound, I think that is in Lagos, every bullet wound must be attended to immediately. No doctor has the right to tell you to go and bring a police report before you are treated. As long as it's emergency, your health is the priority. You must be taken care of first before we start asking for investigation, police report, or even money. See, you can owe a debt up to a cap, I think. You have the right to it, at least in government hospitals. I don't know about the private one. If you know that your health is your right, you do everything to access it, to take care of it, to preserve the environment. You reduce burning of fossil fuels. You manage your waste better. Recycling is another way to conserve the environment. And I know that many Western countries, many European countries are looking into that. not so much in Africa. But I know that times will come to where legislative, bills will be passed concerning this, because we have to preserve our environment in order for us to have access to this care we're talking about. It cuts across many things. Taking responsibility for your health, like I always preach and say here, exercising, eating right, being healthy, staying healthy, all of these are ways by which you can access this your right to health. It's not just about saying it or knowing it, you have to practice it. All right, you have right to access clean water, because if water is not clean, what you take in, use it to cook your food, you drink it could cause ill health. So you have the right to hold your government responsible for these things, and if you can afford it, then you provide it for yourself and your family. So I'm just enhancing, or should I say increasing, the volume on this year's World Health theme that says my health, my right. Yes, you have the right to good health, but please, what are you doing to access this right, to make sure that this right is being utilized? So that's the question I want you to ask yourself. Look at your environment. It's not even only about depending on the government. What are you doing in your environment to ensure that it is healthy for you and for people living in the environment? It boils down to little practices like smoking in public, in non-smoking areas. If you know you want to smoke, you're a smoker, excuse yourself. Don't turn people to second-hand smokers. It goes to you drinking responsibly, even as little as not littering the environment, not pouring wastes into drainages, public drainage, incinerating your waste materials, recycling. All of these are ways to ensure your health. You're exercising your right by being responsible, by doing all of these things. I hope that you get where I'm coming from, and I hope that you get my point. So please, let us take responsibility for our health, even while we are hoping to access this right that we have to good health. I must say that the government tries what they can, but they can't do it alone. Private individuals too, if you have the means, health outreaches once or twice. I know that it's corporate social responsibility for a lot of pharmacists or a lot of pharmacies. They do it all the time. YPG weeks, they go for outreaches, campaigns, awareness, giving free drugs out. All of these are ways to access the right to health care. So please take advantage of them. If you hear about an outreach, don't feel too big to go. Even if you don't need the medications they are sharing there, the information might actually be useful for you. And even if it is not useful for you, it can be useful for somebody else. Another way to take responsibility is by sharing podcasts like this to people, helping them to access the right information, and thereby helping them to really utilize that right they have to healthcare. So that is what I have to discuss with you today. And on that note, I bring this podcast to a close, hoping to see you again on Friday. Remember, it is not enough to have a right. Know that the full potential of the right will be realized when you access it. All right? So, thank you for listening. And I will always say, please, please, please continue to share the podcast. Continue to follow, subscribe, like, on social media, engage us, our email address, antipharmacistpodcast@gmail.com. We're on X, we're on LinkedIn, we're on Instagram. Please, please, and please engage us, comment. Even your comment will go a long way in helping us to improve, know what we're doing right, what we're not doing right, you see. And you could also suggest topics to us. What you want to hear, what is not clear to you, what you heard, maybe a myth or something you're not sure of, just ask. I'm here to shed light on as many health and drug information as possible, on all the questions you might have. So please, I'm at your service. Use me. Okay, thank you so much. once again for listening. Till next time, stay healthy and God bless you. Yeah.